All right, let's decode this NCLEX question together. The nurse is teaching a client who is receiving newly prescribed clopidogrel. Which of the following information should the nurse include? 1. Notify your primary healthcare provider if you are experiencing unusual bruising. 2. Avoid taking over-the-counter medication containing acetaminophen. 3. Avoid driving your car for a short time until your response to the medication is known. 4. Have a blood specimen obtained every 3 months to check your serum albumin level. Now, I gave this particular question to a certain student, right? And the particular student selected to avoid taking over-the-counter medications containing acetaminophen. Now, she explained, she said, acetaminophen is a common medication and combining drugs can be risky, which we try to watch out for drug combination, right? So it must be important to avoid while taking clopidogrel. So I replied, I said, while it is true that certain OTC drugs need caution, right? Acetaminophen does not significantly interact with clopidogrel. This is a distractor answer, which steers you away from the correct priority information. Now, what's the correct answer? 1. Notify your primary healthcare provider if you experience unusual bruising. Let's take it step by step. 1, you need to understand the medication, right? Clopidogrel is an antiplatelet agent that prevents blood clots, right? Its side effects include bleeding risk. So monitoring for unusual bruising or bleeding is crucial, right? And when you try to apply client teaching principle, your teaching should focus on recognizing serious side effects and when to notify the provider. Now, to analyze each option, 1. Unusual bruising is a sign of bleeding and must be reported immediately. 2. There is no major interaction between clopidogrel and acetaminophen, right? 3. Clopidogrel does not impair mental alertness, so driving is not restricted. 4. Monitoring serum albumin is not relevant to clopidogrel use. So why is 1 correct? Unusual bruising indicates a potential side effect that could become life-threatening if ignored. So teaching the client to recognize and act on this warning sign is priority. Now, are you someone struggling with NCLEX question? If you are finding NCLEX question tricky, especially with client teaching, I want you to read my caption now below for my best strategy to master them.